Well, countries around the world are racing to contain the Omicron variant, which is reported to carry a higher risk of infection. Cases of the coronavirus variant have now been detected around the world, including in Botswana, the UK, Germany, Italy, Belgium, Israel, Hong Kong, and the Czech Republic. Even though epidemiologists say that travel restrictions may be too late to stop the variant from circulating globally, many countries, including the US, Indonesia, Kuwait, Brazil, Canada, Egypt, and the European Union nations, have suspended travel from southern African countries. Meanwhile, Dutch health authorities say that 61 people who arrived in Amsterdam on 2 flights from South Africa on a Friday tested positive for COVID-19. The country is conducting further testing to see if any of the infections are of the Omicron variant. Well, CGTN's Angelique Coetzee has more from the Angolan capital of Luanda. Hi there, Angelo. More countries banning travel from South Africa. How are authorities in South Africa responding to this move, Angelo?
So from South Africa's side, our authorities are quite unhappy about what happened. We call it the knee-jerk reaction. And we, from the South African Medical Association, we fully agree with.
Well, we're supposed to be talking to Angelo, who is in Luanda. Let's just ask that question to Angelo again. Angelo, more countries are banning travelers from South Africa. How are authorities in South Africa reacting to the new variant? We seem to have lost Angelo there. Hopefully we'll be able to get him back on the program later on. Well, for more insights on that story, we're joined by Dr. Angelique Coetzee from Johannesburg, South Africa. Dr. Angelique is the chairperson of the South African Medical Association. Thank you so much for being on Africa Live, Doctor. While various countries are banning travelers from countries that have reported the Omicron variant, the World Health Organization, on the other hand, has been suggesting that this may be too late and banning travel might not work. Doctor, what other alternatives might be most effective in dealing with this new variant?
Thank you, and good afternoon to all your viewers out there. Yes, from our viewpoint, from the South African Medical Association viewpoint, we think what would have been prudent would have been to say, as our scientists said, listen, this is what we are seeing. We noticed the new variant. We noticed that there are a lot of mutations, but it's still too early to say whether that it's going to mean that going forward we're going to have severe infections. It's going to spread quite fast. You know, it would have been important for the world to take notice and then look at what is unfolding in South Africa. Remember, we didn't pick up the virus first in South Africa. It is just that our scientists detected it here, but I'm quite sure it's been in other countries for some time. And that our scientists did what they were supposed to do. That's their duty to say, the ethical duty and obligation to say, listen, this is a new variant. Let us sit and discuss it with other countries. Let's look at the regulations that one can do and what would be our options. So instead of doing any of this, we just less than 24 hours of announcing what we are seeing in South Africa, we have been cut off the world, you know, especially with UK in the front. I think it's badly handled. And again, it would have been much better to have negotiations asking us what we are seeing. You know, currently in Gauteng, and the Pretoria is a place where I am practicing, we are the epicenter. Yesterday, the total patients that has been tested positive in Gauteng was 2,264 patients out of 10,000 that has been vaccinated. And the total amount in South Africa yesterday was 3,000, I think 3,000 around 700 patients been tested positive. And the death rate was 8. So those 8 patients, it's not to say that they are part of Omicron, that can be still part of Delta. We don't know how long they have been in the hospital, as we only started to see the clinical picture around about the 18th of November. and it's mild symptoms. So we're not even having a problem in our surgeries currently, with a lot of people coming and an overload of patients to our hospitals. But if you listen to the rest of the world, it is a disaster that struck South Africa. And
Doctor, I would like to ask you, and I think you've alluded to this, but other health experts are also saying that South Africa is essentially what it seems as though being punished for leading and detecting this new variant. What does that do just in terms of reporting? And I mean, I don't think South Africa would stop reporting if they were to detect new variants, and other countries wouldn't either. But what does this mean? And other experts saying that they've quoted that this is unwarranted. This panic that we're seeing is completely unwarranted at this stage. What are your thoughts on that?
Fully agree. Panic is unwarranted at this stage. We don't even know going forward how many severe cases there would be. We don't even know whether vaccinated people will end up in hospital. For what we have seen up till now, in most of the surgeries, that these vaccinated people who got this Omicron has been treated safely at home. Most of them have already been recovered. And so the unvaccinated people. It's not to say that going forward that the picture will change. So what does this tell us? That it tells us that you are being punished if you speak the truth. And this will lead, for going forward, to countries on the political decision-making field not being open about this and transparent. Because the moment you are transparent and open, you are slapped with what we have seen happen to South Africa, with disastrous effect on our economy. And we have said before, no one is safe until everyone is being vaccinated. And that includes Africa. And we have said that the variants will most probably originate from Africa because of the high HIV load in Africa, not only in South Africa. South Africa is just in a better position to have better lab vigilance than the rest of Africa. And if this current gathering of vaccines keeps on escalating and not getting Africa to come to the party, this will happen again and again. So are you going to close your borders every time?
Dr. Coetzee, where you talk about the vaccination and how important that is for the continent, it's been reported that health authorities in Botswana had said that the 4 cases that they had initially detected there had all been people who had been fully vaccinated. What are your insights on that?
Exactly. We have always said that if you are vaccinated, your chances of getting mild disease are there. What we do say, however, why do we vaccinate? We vaccinate to keep you 95% out of hospital with severe cases and prevent you from death. And this would now be put to the task or test going forward to see how many people will that's been vaccinated will get severe diseases. Botswana didn't say to you that those 4 people died. That's not what they said to you. They haven't even comment on the clinical picture as what we are now in South Africa doing and telling the world. That is what we are seeing. We're not seeing severe people, people with severe disease. Not meaning this is what we currently are seeing. It might change going forward.
Thank you so much,
But for now, that's it.
Thank you so much for your time, Dr. Angelique Coetzee from South Africa. Dr. Angelique is the chairperson of the South African Medical Association.